When you think about how medicine is made, you probably picture scientists in labs or giant machines pressing pills. But behind all of that, there's this hidden, high-stakes world dedicated to one single thing, being absolutely, perfectly, scientifically clean. And trust me, it is way more intense than you could ever imagine. So let's just dive right in with the big question. What actually happens inside one of these factories after they finish making a batch of, say, aspirin, and before they start the next batch of something completely different? It's not like they just, hose it down. The whole thing is actually a frantic race, and it's not against one clock, but two. Two invisible, relentless ticking clocks. And if you get the timing wrong on either one of them, well, the consequences can be huge. So let's break this down.
First off, why does any of this matter so much? What's the big deal? Well, it's all about making sure that the medicine we all count on is not just going to work, but that it's, above all, safe. It's about making absolutely sure that not a single unwanted molecule from one medicine gets into another.
And this isn't just some company's internal policy. This is the law of the land, laid down by regulatory bodies like the US FDA. This quote right here, it's the line in the sand. It basically says if you can avoid contamination, you must. There is zero wiggle room because patient safety is everything.
And when we talk about contamination, it's not just about a little bit of leftover drug. We're talking about all kinds of unseen threats. You could have residue from the cleaning chemicals themselves or, and this is a scary one, you could have dangerous microbes starting to grow in the equipment. Sometimes residues can even dry and harden like cement, making them almost impossible to get rid of.
Okay, so this brings us to the two ticking clocks I mentioned. These are the two critical time windows that every pharmaceutical company has to prove they can control. This is the core of the whole challenge. Clock number one is what's called the dirty equipment hold time. Honestly, the best way to think about it is like a dirty lasagna pan. The second you take that last piece of lasagna out, the clock starts. You know what happens if you let it sit on the counter overnight, right? That cheese and sauce basically turn into concrete. It's the exact same idea here, just with much more at stake.
Now, for clock number two, the clean equipment hold time. So let's go back to our lasagna pan. You've scrubbed it, it's sparkling clean, awesome. But can you just leave it out on the kitchen counter for 3 weeks and then use it to cook dinner? No way, right? It's gonna get dusty, maybe some germs land on it. Well, that's CEHT. It's the maximum amount of time that a perfectly clean piece of equipment can just sit there before the environment starts to make it dirty again.
So you see, each clock comes with a totally different enemy. With the dirty hold time, the enemy is inside the machine. It's the leftover gunk getting harder and harder to clean. But with the clean hold time, the enemy is outside. It's the dust, the air, the microbes in the room, all trying to get back in. So how in the world do you manage these two ticking clocks? You can't just guess. Regulators demand a plan, a scientific, systematic strategy to stay ahead of all these risks. It's kind of like a 5-step blueprint for achieving perfect cleanliness. In this process right here is the global standard. It's what separates science from guesswork. You start by identifying every single thing that could possibly go wrong. Then you figure out how bad each of those things would be. After that, you focus your energy on the biggest, scariest threats first. Then you put controls in place to stop them. And this is key, you never ever stop checking and improving. Okay, now we get to what I think is the most clever part of this whole story. A big factory might make dozens, even hundreds of different medicines using the same equipment. How can they possibly prove that their cleaning process works for every single one of them?
Seriously, think about it for a second. Trying to test every single drug on every piece of equipment in every possible sequence, it would be an absolutely monumental task. It would be insanely expensive and take forever. So, what do?
The solution is it's elegant, it's brilliant. It's called worst-case testing. The logic is beautifully simple. If you can prove that your cleaning method works on the absolute hardest to clean thing you make, then by default, you've also proven it can handle all the easier ones.
So what makes something a worst-case product? Well, scientists look at a few things. Is it really hard to dissolve, like trying to wash off oil with just water? Is it super potent, where even a microscopic trace could be a problem? Or is it just really, really sticky? These all factor in. But, and here's the twist, the answer is not always what you think. You would probably assume that the worst-case product is the one with the strongest or least soluble active ingredient, right? I mean, that's the medicine part of the medicine. But that assumption can be completely, totally wrong. It's not just about the star of the show, it's about the entire recipe.
This is a perfect example. Take a look at product A2. It's the only one here where the active ingredient, the API, is insoluble. So common sense says that's your worst case, but look again. Product A1's active ingredient is soluble, but all its other ingredients, the fillers, the binders, are not. In total, 85% of product A1 is insoluble gunk. That's the real cleaning nightmare, not product A2. It's the whole recipe that matters.
So you've identified your true worst case, you've run the cleaning process. Now what? How do you actually prove it's clean? You can't just look at it and say, yep, looks good. This is where the science of measurement kicks in.
Scientists basically have two main tools. The first is swab sampling. Think of it like a detective using a cotton swab to get a DNA sample from a specific, hard-to-reach corner. It's incredibly precise. The other tool is rinse sampling. That's more like power washing the whole inside of the machine and then testing the dirty water to see what comes out. It gives you a great overall picture. The best cleaning programs, of course, use both.
And this is so important. In this world, clean is not a feeling. It's not an opinion. It is a number. This value you see here, less than 25 colony-forming units per 25 square centimeters, that's a typical limit for how many microbes are allowed to be there. It is a hard, scientific, measurable benchmark for what is considered safe.
And remember, getting something clean is only half the battle. Keeping it clean is a whole other active process. You have to build a kind of fortress around the equipment. You're controlling the temperature, the humidity, even using positive air pressure to constantly push contaminants out of the room. It's like creating a protective bubble. And get this, if you do all of this science exactly right, the results are just mind-blowing. It's not unheard of for equipment that's been properly cleaned, dried, and protected to stay in a validated clean state for months, and in some documented cases, for over 2 years. That's how powerful this science is.
So, the next time you open a bottle of medicine, just take a second to think about this incredible invisible science that happened between the batches. This meticulous, pressure-filled race against time is the standard of care that is protecting you and your family. So the final question is, how does knowing all this is going on behind the scenes change the way you feel about the medicine you trust?